The Trump administration made a big promise back in the fall.
Operation Warp Speed is taking an unprecedented action to make sure that vaccine is delivered to hundreds of millions of people before the end of the year.
But just within a few months, the numbers started to dwindle.
Over 100 million doses will be available before the end of the year.
By the end of the year, we should be able to immunize 40 million people.
20 million people should get vaccinated in just the next several weeks.
And the U.S. still didn't meet that goal. Only 2.7 million Americans were vaccinated as of December 31st, according to our NBC News COVID vaccine tracker. And as of January 11th, that number stands at 6.6 million, almost 2 weeks into the new year. So why are vaccines rolling out this slowly?
There's the allocation, there's the shipping, there's the distribution, and there's finally getting in people's arms.
Health experts can't point to one single reason for the slowdown, but after tracking distribution over the last several weeks, we've identified some key problems. Number one, overwhelmed and underfunded health systems. With COVID hospitalizations still near all-time highs, hospitals across the country are already struggling to care for patients. And there just aren't enough resources right now to simultaneously focus on the biggest vaccination effort in U.S. history.
We are working so hard and working to support our team, and we need our community to support us.
State and local health departments are also juggling this massive undertaking. They were tasked with setting the rollout schedule and standards, and many were already underfunded and short-staffed before the pandemic. An analysis from the Associated Press and Kaiser Health News found state health department spending down 16% per person over the last decade, and most states spend less than $100 a person on public health. Now, these health systems are stretched thinner between distributing testing, PPE, and vaccines.
There really has to be a lot more effort in the sense of resources for the locals, namely the states, the cities, the counties.
It's worth noting the latest COVID relief deal includes between $8 and $9 billion to help health departments with distribution efforts. So that money should be helping the process soon. But this brings us to issue number two, lack of coordination from the federal government.
There really wasn't a lot of support, no financial support and no real plan.
Operation Warp Speed does deserve credit for heavily investing in vaccine development. It paid pharmaceutical companies to produce more of the vaccine even before it was approved, a bet that's paid off to a certain extent. But once those vaccines shipped, the federal government asked states to take it from there.
It's really a state and local level to get vaccines in arms, like it always is. The federal government doesn't invade Texas or Montana and provide shots to people.
But Warp Speed's mission wasn't just to create a vaccine. They were also supposed to help with distribution.
Its objective is to finish developing and then to manufacture and distribute a proven coronavirus vaccine as fast as possible.
And because every state has their own distribution plan, we're seeing a messy patchwork of strategies, similar to the testing shortage that we saw in the spring. In Florida, healthcare workers and older adults waited hours overnight as doses were administered on a first-come, first-served basis. In Texas, some rural hospitals haven't gotten any doses yet.
The folks I've been talking to here tell me that they've essentially been stuck in running this gauntlet of paperwork bureaucracy, trying to get approved to get the COVID vaccine.
And in West Virginia, over 40 people accidentally received a COVID antibody treatment instead of the Moderna vaccine. Still, federal officials insist they've delivered on their promises, instead blaming the low numbers on lags in reporting. But there's another potential problem here: vaccine hesitancy.
Our bigger concern, though, is the number of staff that are not taking.
Ohio Governor Mike DeWine said about 60% of nursing home staffers refused the vaccine around New Year's. And while the majority of Americans now say they will get vaccinated, 62% said they'd be uncomfortable being one of the first people to receive a dose. All of these issues together are leading to vaccines sitting in freezers instead of getting into arms. And there are concerns that some doses are even going bad, leading to calls to widen those eligible. For example, New York is now allowing other public-facing workers to get vaccinated to better ensure all available doses are used.
The Trump administration's plan to distribute vaccines is falling behind, far behind. The Biden-Harris administration will spare no effort to make sure people get vaccinated.
President-elect Biden has criticized the delays, promising to release more vaccine doses rather than stockpiling them on shelves. But given this range of rollout problems, it's impossible to know if he'll meet that goal once he takes office.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.